All right, guys, so one of the things that we're working on right now in terms of mobility work to help us eliminate the butt wink. And what I mean by that, guys, is when we begin our squat, whether it's a back squat, front squat, overhead, whatever it may be, some people do initiate their squat by basically really just unfolding at the hip. In other words, they kind of just break down around that pelvic area. What we're trying to do, guys, is basically eliminate that. And one of the things we had worked on yesterday, Tuesday as a matter of fact, was when we get ourselves into this kneeling position, and let's say we want to have an anterior lean forward. One of the things we don't want to occur really with that is where we're breaking here, in this lower back, just above the hip area type section of the body, where that if I go forward, I'm not just going to break at the back to do so. One of the things I'd like to have you guys consider is that if you guys are carpenters, and you got your carpenter belt on, you put that belt in your carpenter belt itself, and then when it does, it just hangs. It just hangs neutrally here. When it hangs neutrally here, that basically aligns itself with your leg bone, your humerus. If you guys were to go forward and just simply, again, break the back, the lower back that is, your hammer would basically then do this, let's say. What I'm wanting you guys to do is that if you use something, let's say, to assist and hold on to, if anything, pretend your hammer joint has to actually tilt back. In other words, think of taking the top of your hip bone and actually pulling it back. In other words, squeezing the butt to help do so. Get that top of, again, that leg bone to be fixated back, so that now when you guys lean forward from the knee joint on up, you are one straight line. And what's going to happen is you will feel a tremendous difference within your quad muscle, the front of your hip flexor. And that's what we're looking to do, is we're looking to keep this area fixated as we lean forward. Hope that helps you guys out a little bit.